I'd now like to introduce Claire O'Neill, who is the Acting Senior Manager of RDN's outreach programs. She leads a team responsible for the implementation of all health outreach services across New South Wales and the ACT. Claire has been with RDN since 2013 and has recently completed her Masters in Public Health and a Masters in Health Management. I welcome Claire to provide an update on RDN over the last year.
Thanks, Mike. I too would like to begin by acknowledging the traditional owners of the many lands on which we are meeting today and pay my respects to Aboriginal elders past, present and emerging. I'd also like to particularly acknowledge all of our Aboriginal colleagues joining as participants or speaking as part of the forum today and extend my sincere gratitude for the work that you do every day to improve our health system for Aboriginal people. For those of you who don't know me, my name is Claire O'Neill and I'm the Acting Senior Manager for RDN's outreach programs. I took on this role in April when Sharif Bagnulo took a secondment to the New South Wales Ministry of Health. Previously at RDN, I was the Ear and Eye Health Outreach Program Manager, and a lot of my work at RDN has really been around designing and implementing our needs assessment processes. So I'll just give you an overview of my talk today. The purpose of me being here is really to give you a bit of a refresh, remind you of what the outreach programs are, and I'll also outline the various programs and some of the changes to the Commonwealth's outreach programs that are run in New South Wales and the ACT. I will then take you through some of the achievements that we've seen over the last year. As many of you would be aware, 2020 has been a big year, and there has still been quite a lot of activity in these programs. So I look forward to sharing a bit of that with you. And finally, I'll close up just with a few comments about what you can expect from working with RDN over the next 4 years. So I'll begin with the introduction. So first I will start with why outreach. So those of you who are familiar with RDN would be familiar with our vision to support healthier Australians no matter where they live. The outreach programs are a significant component to that because they aim to increase access to health services for patients living in regional, rural, remote and Aboriginal community services. There are a lot of different definitions in terms of the youth outreach. So for our purposes, we do have quite a specific way that we use outreach, and we are really referring just to the services that are formally funded through the RDN's Commonwealth Health programs. There are obviously there's other kinds of outreach that run across New South Wales. There's lots of different kinds of private outreach and outreach clinical services. Those might form some of the outreach clinical models. But for me moving forward today, an outreach service, when I speak to that language, I am actually speaking about a particular type of health practitioner that visits a set number of days to a particular town. So for example, a diabetes educator that visits the town of Walgett once per month. The outreach program, or the way that RDN runs it, is really about running identifying and responding to gaps. So it provides secondary and tertiary services. It doesn't provide primary services, and they're really not designed to respond to acute or community needs. Rather, it is around those additional specialized and wraparound services that a community might need to support good access to healthcare. Some of the specialized services that we provide through outreach might target diabetes, they might target mental health, they might target Aboriginal ear and eye health. So they're specialized services delivered by medical specialists, allied health workers and nurses, and respond to priority community needs. And they often respond to the major barriers that rural and Aboriginal communities might experience in accessing health services. The distance and disruption to access alternative services from travelling to major centres is a main component of why you might place an outreach service in one town. Cost and economic hurdles and cultural safety barriers can be other reasons that you might also have a visiting outreach service in place. And those services generally look to strengthen the capacity of local services. Often they provide upskilling as well. So outreach programs support some of the costs of delivering services. They don't cover everything, but they're really there to, avoid economic disincentive for medical specialists and allied health practitioners who might want to provide services outside of their usual place of practice. So they cover things like health practitioner travel and accommodation, some professional support that might be supported between visits, room hire for the clinics on the day, upskilling, cultural safety, and there's a little bit of eligibility criteria around that, but that's what the outreach team is available to support you to design and I guess identify the most appropriate needs for your particular service if that's approved. The outreach workforce has about 38 health disciplines at the moment, and we estimate that about a third of them actually are based in regional areas and provide services to other parts of their region, which is, I suppose, a little bit counterintuitive. A lot of people think that all visiting outreach services come from Sydney in New South Wales, but they actually come from across the state. In New South Wales, outreach is delivered directly by 33 Aboriginal health organisations, 10 local health districts, and 16 other primary care organisations to about over 300 host facilities. Those models, the reason that we have all of these organisations that we partner with is because we aim to decentralise the delivery of those services as much as possible by using local organisations to make sure that they're able to provide services. That's how we know that they align with communities' priority needs, and that's how we see those services offering the best value to the community that they are visiting. They're also designed with the intent of really building local capacity, and that helps the existing clinicians in that town provide better care to their patients. And this is also a mechanism for helping us to avoid duplication of services. The last thing you want is to have two of the same type of service visiting the same town on the same day. So in the RDN team, we have about 8 people who manage the outreach program. They're responsible for working with these partner organizations to do service planning, manage contracts, recruitment, support those local agencies to be able to provide those outreach services. But the true size of that program administration is an awful lot larger than that. We estimate that there are about 200 outreach sort of service administrators or health administrators that are responsible for actually delivering outreach clinics on the ground. Those consist of local primary care workers, GPs, Aboriginal health workers, practice managers, and other staff that make sure that this services that are funded through this program have referrals, they have patients, they're responding to community needs, and that they, essentially run on the day. Every year, RDN then works with these organizations to review funding agreements, assess the needs for the services, and look at continuing to reprioritize funding to make sure that the services that your community is receiving are aligned with priority community needs. If you're not familiar with them, and I hope that some of the stakeholders here today might be well familiar with these over the many years that these programs have been in place. When I'm speaking about outreach programs, we're talking about the Rural Health Outreach Fund, the Medical Outreach Indigenous Chronic Disease Program, the Healthy Ears, Better Hearing, Better Listening Program, the Visiting Optometry Scheme, the Ear and Eye Surgical Support Service. All of those are services that they're programs that specifically deliver services, and there are also introduced this year. We now have 2 areas of coordination programs. So there is an eye health coordination project, which you might be familiar with, and there's a new ear health coordination project that RDN is delivering in partnership with the Aboriginal Health and Medical Research Council. Most of the outreach programs are now on 4-year funding agreements, and we've had it confirmed that they will be funded until 2024. You can see those dates on the slide here, and they all have slightly different access criteria and different targets. So for example, the Rural Health Outreach Fund this year had an expansion to include pain management. The Medical Outreach Indigenous Chronic Disease Program had an expansion to include additional ophthalmology services 2 years ago. The Healthy Ears Program was recently expanded for additional services to target the 0 to 6 age group, which aligns with the existing program. The Visiting Optometry Scheme, as you know, just targets improved access to optometry. And the Ear and Eye Surgical Support Service expedites access to surgical interventions. So that's a bit of a handy reference and a bit of a debrief on what the outreach programs are and I guess the stakeholder cohort that we've brought here today. And I'll now move on to what these programs have achieved in the 2019-20 financial year. So the slide that I've got here now is showing some of the key highlights from our clinical services that we've achieved so far this year. So you can see we have 1,148 currently funded outreach services. Most of those services focus on targeting chronic disease, pediatric needs, mental health, ear and eye health needs, and Aboriginal health. We still have over 900 medical, allied health, and nursing health practitioners that are delivering services under these programs, and those practitioners represent over 65 specialties and disciplines. As of the 30th of March this year, which was the end of our last quarterly report, we've funded about 12,773 visits across 153 rural, regional, and Aboriginal towns. And we've recorded nearly 150,000 patients' occasions of service. The number of towns that we've visited this year and the number of patients' occasions of service is a little bit lower than what it normally is, which is probably not surprising given the impact of COVID and bushfires, among many other things that have happened this year. So we are anticipating that this year there will be slightly less occasions of service than there would normally be. The Aboriginal Eye Health Coordination Project has been running for a couple of years now. For those who aren't familiar with it, it's designed around supporting regional stakeholders to come together and work on needs that are appropriate for the eye health pathway within their community. We identified early on about 15 different regions in New South Wales of how organisations group together, and RDN really acts as a bit of a secretariat for those regional groups to bring them together and respond to needs as they request it. So some of those regions are meeting quite frequently at the moment, almost quarterly, others biannually, and some just once per year. In addition to the regional activity that happens under that program, the advisory group Aboriginal Eye Health is still meeting. So this group is now meeting twice per year, and this year in the last 6 months, they had their meeting on Zoom for the first time, fully digital, given all of our social distancing measures that we had in place. But we also were joined by 2 Aboriginal medical services that talked about the role of what's happening in the regional groups and what it means to their services. The current concerns that the advisory group Aboriginal Eye Health are considering in their discussions is really looking at the risk of the gap in vision widening due to the impacts of COVID-19, particularly the slowdown or stop for a period of time of elective surgery, and advocating as much as we can to ensure that there's still equity of outcomes within that space, and as COVID restrictions slowly wind down, finding ways to make sure that equity for Aboriginal people is not forgotten. As I think I've mentioned previously, there have been a couple of new initiatives that started in 2019-20, so I'm going to take you through a couple of them now. The first one was the Rural Health Outreach Fund had an expansion to address pain management. We also had our Healthy Ears program expanded for additional ear and hearing health services, and we had the introduction of our AHMRC Ear Health Coordination program. So first is the expansion of the Rural Health Outreach Fund to include an additional funding to support pain management services. So this expansion is one of a range of initiatives that comes from the Australian National Drug Strategy. It's expected to run for approximately 2 years, or initially it was funded for 2 years, basically planned to support services that increase access to pain management for people living in remote and rural New South Wales communities and enhance the skills and resources available to primary care providers. So a lot of what the program is intended to do is assisting patients to access their current best practice pain management specialties by expanding the available specialised services and providing upskilling opportunities to rural primary health providers. The team has been working over the last 6 months doing regional engagement to design exactly what that funding will look like for each region in New South Wales. It's targeted to activities in RAs 2 to 5, so everything outside of rural areas. And really the ideas are around reducing harm, enhancing local capacity. So watch this space to see what kind of initiatives come up in your area, and please get in touch with us if there are needs that you haven't been in discussion with us about yet. The second expansion of service-related funding that we've had over this financial year is the follow-up ear and hearing health service. So this is an expansion of funding that aims to improve ear and hearing health for Aboriginal children in the years before they start school. It was designed in order to expand services that are currently funded under the Healthy Ears, Better Hearing, Better Listening program, where they might see increased access to needs because of the introduction of Hearing Australia's hearing assessment program. The services that might be funded through this program might be additional audiology services, additional speech pathology services, and we're anticipating a significant need for ENT consultations and procedures. So this is priority for areas MMM 4 to 7. And when we go through the service prioritization process, we will be giving priority to services that demonstrate referrals from the HAPPY program. But we'll also quite happily work with stakeholders to identify what the needs are for their local community to make sure that there aren't any gaps. We do know that there are significant needs for services to this target population, and we're very welcome to having further discussions. I would say keep an eye out in your inbox if you hadn't seen it already. You should be receiving a needs assessment for that program very shortly. Following on for some of RDN's work in the ear and hearing health space, the 2019-20 financial year also brought with it the establishment of RDN and AHMRC's first formal funding partnership, whereby the AHMRC funds RDN to be providing support to deliver the new hearing coordination program. So it's an expansion on the hearing coordination program that AHMRC has run for many years prior, but it's received a little bit of growth to be able to resource a much broader focus, which we're pretty excited about. Some of you may have already seen that there is a needs assessment looking at the full suite of needs across the hearing pathway, from workforce development, training, equipment, and service-related needs, looking at what that will be in New South Wales. We've also worked through establishing the first state and territory-wide advisory group on Aboriginal hearing health. So it's aligned a little bit to the work that the iHealth group is doing, but this group will be co-chaired by the AHMRC and RDN. In addition to that, in the first 6 months of the program, the Hearing Health team have also created a Hearing Health group on Rural Health Pro, which is it's designed to provide space to connect with colleagues, share resources, create discussion about best practice in hearing health for stakeholders across New South Wales. There's also an online resource library, things that you might find useful in your own practice. And we're also looking to facilitate a number of online events, including hearing assessment screening tools training for the plum and the hats, and also doing a PIMS data series for hearing health, which is designed to help improve data management processes in your primary care information management system when you have hearing health services visiting. The beautiful artwork that you can see here is one that was designed through a competition that the AHMRC hosted, and big congratulations to Madison Connors for the winning artwork submission, which is Winanga to Hear. This artwork will actually be translated and used as the story as part of all of the hearing health work moving forward. Okay, so the last 6 months have been unprecedented, I would say, in most human history, and our outreach services have certainly experienced a significant impact through natural disasters, through the bushfires, as well as COVID-19. RDN is continuing to try to be as adaptable and flexible as we can to make sure that local communities are able to access services, but can access those in the most appropriate and safe way to do so during this time. Over the last 6 months, we've noted that about 23% of our services that transitioned very quickly to telehealth. And we estimate that about 21% of our services during this time had to temporarily suspend services in order to maintain patient and health practitioner safety. And we've been working with those services to identify alternative ways that they might be able to provide emergency or other kinds of access to care via telehealth or through other means to make sure that patients aren't missing out on access to care where they need it. There have been some other impacts as well. We had about 94 new services that we have had to suspend development of during COVID, just because it wasn't the right time to be introducing new services, or that our recruitment needs that have been put on hold. There were also about 11 services that were cancelled, but there are also some good news. There is some good news, sorry. We did have about 351 services that still were able to continue providing services as normal. So that's about just over 25% of RDN's currently funded services continued as normal, but applied safe COVID practice to their work. To give you a bit of an understanding of some of the services that were suspended during this time, we had optometry services, a few medical specialty services like ENT, dermatology and surgery suspended for the time being. But many of those, again, demonstrated that their commitment to the providing of services to their community and have adapted in the best way that they could. And there is some light at the end of the tunnel, in that some do seem to be adapting back to business as normal. We will be passing on additional requirements around COVID in our funding agreements for next year, and I suppose the intention is to keep working with you to identify the best way that we can provide services in your community. And all I can say in that space is we really welcome that engagement and hope that we can provide you with as much support as you need during this time. So one of the initiatives that RDN is usually really excited about supporting is our Outreach Student Placement Program. This year, the majority of our Outreach Student Placement Program was actually suspended due to COVID, but we did happen to get one student out there, meet Digby. Digby had the pleasure of going out to Cobar with one of our visiting ophthalmologists that's supported through the RHOF program to see what it is like to be an outreach clinician. And it was interesting to see his pun about things being really eye-opening. But I suppose looking into understanding the work that goes into supporting an outreach clinic, booking plans for doctors, ensuring patients are confirmed, and the availability of operating theatres and other things. I think this is something that RDN is hoping to fund and support again next year, but this is important for two reasons. One, because it provides us an opportunity to create relationships between clinicians that may mean that a student would have an interest when they finish in continuing to deliver outreach services, but it's also an opportunity for them to see what rural practice might be like and hopefully continue building their commitments and their connections to rural communities. So we view this as a potential succession planning opportunity as well. For those of you who aren't familiar with it, RDN actually facilitates several student programs like the Bush Bursary Program, the Country Women's Association Scholarships, our Cadets Program, Go Rural, the John Flynn Placement Program, as well as a new high school student forum. And that's really around building the pipeline of future rural health professionals. One of the things I wanted to end on as one of the reflections, I suppose, for some of the key achievements was this snippet of a patient quote that we received this year. I will just let this sit on this slide for a minute, just to allow you to digest it. It's not my words, it's the patient's words. And unfortunately, I had to snip it a little bit so that it would fit on the slide, but I'll just leave that one for a moment. I think for me, the impact of the outreach clinician and that service being provided to a community is It's the crux of what an outreach service intends to do. We survey patients and we survey health practitioners on an annual basis. We continue to get positive feedback. 98% of outreach patients report being satisfied with the services that they provide, but sometimes the context that you see on this slide here gives you a little bit more of an understanding of what that service might mean to a patient. One of the key highlights that we heard from a patient story this year was that about 63% of patients attending an outreach clinic wait less than a month for an appointment. That's a pretty significant win, and I think it shows that you've got services that are visiting the right places at the right time and that they're available for patients. We also found that about 75% of Aboriginal patients wait less than a month, so that's a really encouraging result. One of the things that I haven't shown here is that we also survey our outreach health practitioners. They also continue to provide really high ratings of the outreach program and particularly give us feedback around the value that they see in providing those services. And the feedback that we get from both the patient surveys, our outreach clinicians, and surveys from host facilities are collated and they're worked with to design program activities for the following year. So the team's taken a lot of that survey information on board and they're using that for planning for next year, whether that's adapting the way that RDN works or that's adapting the way that we work with some of our subcontractors to continuously aim to improve the services that patients are receiving and that clinicians are able to provide. So, looking forward, we are entering a new 4-year funding cycle for most of our funded programs. So we are looking forward to working with those services to adapt to a new normal. We'll obviously experience a continued need to deliver services that are in line with relevant Commonwealth and jurisdictional advice. We are seeing revisions to some of the program service delivery standards and the transition to supporting services under the MMM geography standard as opposed to the RA system. And we're also anticipating an increased role of telehealth for some of the outreach clinical service delivery that we fund. We are also excited that we will see some growth we will see growth in services for some of our programs. So in the next 12 months in particular, you should be seeing an introduction of RHOF pain management services within your area, if you're in an eligible geography. You should also see some new services, so changes to existing programs. We haven't necessarily received additional funding, but changes in priorities have meant that there will be some new services that will be funded under the Medical Outreach Indigenous Chronic Disease program. And we anticipate an increase in services from the Hearing Health program as well. And we're also seeing a little bit of growth in the Visiting Optometrist scheme. One of the key activities for the next year is also to look into our cultural safety protocols to make sure that we have the right kind of tools available to support people to be able to make sure that outreach health practitioners and other service providers are culturally safe. And we look forward to consulting with HMRC on what that should look like to make sure that it's appropriate for the needs of communities in New South Wales. And we're also hoping to be able to support the Outreach Student Placement Program. And that's, of course, pending available funds. But I think we've been successful over the last couple of years of finding it. So watch this space. But I hope that we manage to achieve that here. We've also, I suppose, worked through a lot of planning and risk and adapting our risk management strategy this year. So you will also probably see some shifts in the way that RDN works with subcontractors to make sure that we're meeting the current guidelines around adapting to this new normal, and we look forward to working with you on that too. So before I close, I do want to give a huge acknowledgement to the outreach team, the subcontractors, almost 60 subcontractors and and over 900 health practitioners that provide services under this program. This would not be a success without you. We really hope that you enjoy the rest of the program that we've put together for you today, and we also look forward to engaging with you in Rural Health Pro today and in the coming weeks. Thanks so much for listening.